Hey health warriors, ever cared for a patient with lower abdominal pain and a sudden change in bowel habits and found out it wasn't appendicitis? Today we're diving into diverticulitis, what it is, how it's different from diverticulosis, and what every nurse needs to know for treatment, recovery, and patient education. Diverticulosis means small pouches or diverticula form in the wall of the colon, often from chronic low-fiber diets and straining. It's usually asymptomatic, and most people don't know they have it. Diverticulitis happens when one or more of those pouches become inflamed or infected, causing acute symptoms, and often requiring medical intervention. Low-fiber diet, chronic constipation, aging, more common after age 40, obesity, lack of physical activity, smoking, and NSAID overuse are common causes and risk factors. The condition is most often seen in the sigmoid colon where pressure is highest. Symptoms of diverticulitis include left lower quadrant pain, fever, chills, nausea or vomiting, change in bowel habits, either diarrhea or constipation, tenderness on palpation, and in severe cases, abscess, perforation, or peritonitis. Diagnosis involves a physical exam with left lower quadrant tenderness, CBC to look for elevated white blood cells, and a CT scan of the abdomen pelvis, which is the gold standard to confirm inflammation or complications. Avoid colonoscopy during the acute phase due to the risk of perforation. For mild cases, outpatient treatment includes a clear liquid diet that advances as tolerated oral antibiotics like ciprofloxacin plus metronidazole or amoxicillin clavulanate, and acetaminophen for pain while avoiding NSAIDs. Moderate to severe cases require inpatient care with NPO status and IV fluids, IV antibiotics, and monitoring for abscess, fistula, or perforation. Surgical intervention such as colectomy is considered for recurrent diverticulitis or complications like abscess or obstruction. During the acute phase, a low residue or clear liquid diet is recommended. After recovery, patients should transition to a high-fiber diet to prevent recurrence. Hydration and regular exercise are also crucial. It's important to note that seeds and nuts should be avoided only if the patient is symptomatic. They are no longer universally restricted. Monitor pain, bowel sounds, and lab trends. Administer antibiotics and fluids as ordered. Encourage early ambulation if tolerated. Educate on diet progression and reinforce the importance of fiber intake and hydration. Teach patients to recognize signs of recurrence or complications, such as fever, worsening pain, or rectal bleeding. With the right support and patient education, most cases of diverticulitis resolve without surgery. Nurses play a key role in recovery and prevention. Have you supported someone through a diverticulitis flare? Share your best nursing tips in the comments. Like, subscribe, and follow for more frontline clinical breakdowns made clear.